Heart failure is an entity which means that the person is living with a hurting heart. And as the management of coronary artery disease and other disorders causing the heart failure has changed over time, the burden of heart failure has markedly increased. There are about 21 million heart failure patients worldwide, and it leads to an economic loss of about $100+ billion per year. Heart failure is the number one cause of rehospitalization in elderly group of patients, and if we talk about the mortality is about 50% at 5 years after the diagnosis of heart failure and 25% at 10 years after the diagnosis of heart failure, irrespective of the treatment modality given to that particular group of patients. And if we talk about the same thing in the Indian scenario, the figures are altogether much deadlier and different. The younger group of patients are having the heart failure. The mean age of having the heart failure in Indian scenario is 53 years, which in comparison to the global scenario is 65 years. The mortality also is about 30%. As compared to 3 to 4% at the global scenario. And if we talk about the mortality at 6 months after the discharge of the heart failure patients, it was 4 times higher in the Indian group as compared to the global scenario. So there has been a marked change in the management of heart failure patients. We have a lot of medications, almost over 3 or 4 groups of medications have come recently in the treatment of heart failure. We have the surgical interventions like the aneurysmal bypass graft surgeries, the aneurysmographies, the valve repairs. We have the interventions in the form of stenting or valve interventions, and we have the device therapies also. So the heart failure patients, in short, I can say is that the burden is going to increase in the near future. But the armamentarium what we have in our kitty for the treatment of these heart failure patients, that's in the form of medication, in the form of device therapies, in the form of interventions, in the form of bypass surgeries or surgical interventions, we need to use them judiciously so that the burden of the heart failure is decreased and the mortality as well as the morbidity of these patients is markedly decreased in near future.